services. Okay, this was the year 1918 to 1941, and then next week we will be discussing about the current public health system in the country, now specifically our Department of Health and the department secretaries. Okay, so let's start. This is just a 29 slide presentation, so we'll finish in a matter of time lang. Sige. Okay. So the Americans built, during this year 1918 to 1941, the Americans built the University of the Philippines College of Medicine and Surgery in the year 1905, using the blueprint of the best medical school at that time, the Johns Hopkins University. So if you are familiar with Johns Hopkins University, it's very notable to know, no, that our own University of the Philippines here in our country was patterned, no, through the Johns Hopkins University, no. On September 10, 1910, the Philippine General Hospital was opened. So under the flagship, no, of the University of the Philippines College of Medicine, the Philippine General Hospital was opened in that date, September 10, 1910, under the directorship of Dr. Victor Heiser. So this is the election of the Democratic candidate Woodrow Wilson in 1912 as U.S. President signaled a change in policy towards the Philippines, a change that was effected by Francis Harrison, who served as Governor General to the islands for 8 years. So Harrison's term became known for opening the civil government to greater Filipino participation. Okay, so on your right is Woodrow Wilson, on your left is Francis Harrison. I know, on your left, is Woodrow Wilson, and on your right is Francis Harrison. We have what we call the Jones Law. It was passed on 1916 and was crafted to formalize the U.S. commitment towards the Philippine independence. We were under the Americans, but during that time, they were transitioning us to become independent. Now, if you would be able to recall your history, the Americans deny, or the Americans do not consider them as the colonizers, because they were the ones helping us, transitioning from their help, towards a independent Philippines. So they passed this Jones Law, and this law created the Philippine Senate and authorized the organization of the executive departments of the government. So under this act, under this law, there was an act number 222 with wherein there's a creation of 4 departments, and then among them is the Department of Public Instruction. So under this department, it fills the direction and the supervision of the Philippine Health Services. Okay, so under the Department of Public Instruction, didaan aton supervision of the health services in the Philippines. While leadership roles were gradually assumed by Filipinos, the portfolio of the Department of Instruction remained in the hands of the Americans. There were Filipinos already in the body, but most of the people, the composition of the Department of Public Instruction was still with the Americans. So Dr. Vicente de Jesus was appointed the first Filipino Assistant Director of the Philippine Health Service on January 22, 1914. When Director Victor Heiser resigned from being the medical director of PGH, he was then replaced by Dr. John Long on 1915. So, nagtitikang na, ng Filipino ang mga nangapot. 5 years after, on January 1, 1919, the full Filipinization of the service was headed by Dr. Vicente de Jesus by being the first Filipino director of PGH. Despite the great strides achieved by the previous administration, the Wood-Forbes mission painted a grim picture. No? So the 8 years of democratic administration ended in 1921 when the ascension of Republican Warren Harding to the presidency of the United States. No? Na nabalyuan. No? Almost immediately, an investigation and evaluation of the conditions in the Philippines under the policies of the Democratic administration was conducted, headed by Major General Leonard Wood and former Governor General William Forbes. So these two, okay? So they were replaced. The Jones, the previous Democratic administration was replaced by this Republican administration, and inihirangaduha, Major General Leonard Wood and former Governor General William Forbes were the one who investigated kung ano na hinabok din na Philippines during that democratic administration. But despite the great strides, the Wood-Forbes mission painted a grim picture of health and sanitary conditions in the Philippines. So after their investigation, because syempre they are kabilang partido, they painted a grim picture of the health and sanitary conditions in the Philippines, saying that the excellent health service which had previously existed had become largely inert. They noted the lack of hospitals and dispensaries and the loss of zeal and vigor among the health personnel. For a population of 10.5 million Filipinos during that time, there were only 930 nurses in the country. So the statistics of the Philippine Health Service also showed a steady increase in recent years in the number of cases of preventable diseases. Particularly, dumamo ang typhoid, malaria, beriberi, and tuberculosis. The effective methods applied in healthcare had resulted in the deaths of more than 50,000 people and the steady rise in cases of typhoid fever. A great shortage of doctors, nurses, and properly trained sanitary personnel was another challenge to the system, which is still a challenge for us healthcare workers right now in the Philippines. There were only 930 nurses for a population of 10.5 million Filipinos, and outside of the largest towns, hospitals were so few and far between. So the universal healthcare that we are implementing right now will help us bridge this gap. Because until now, we can see really the scarcity of hospitals and any dispensaries in the provinces. Outside the largest towns, hospitals were so few. As well, facilities for lepers and the mentally ill were found terribly insufficient. So Major General Leonard Wood himself took the lead in addressing the health problems. The health problems that his mission identified. The physician, sanitarian of the world-renowned humanitarian and former governor of the Muslim provinces in Mindanao, formally assumed office as Governor General of the Philippines on October 15, 1921. So, he stressed the need to give more attention to matters of public health and sanitation, which holds true until now, because there were too many precious lives which were lost each year that could be saved and easily saved. So they focused on public health. To stem the tide of increasing public health problems, the many health functions widely scattered among many departments of the government were placed under one head. What followed were a series of programs and policies that had significant impact on the health conditions in the country. Okay. So as a response, the Philippine legislature passed Act number 3,200 on this date, December 2, 1924, in support of the puericulture centers. So the puericulture centers, because there was a need, they thought they were able to realize that there was a gap on mga hospitals. Puericulture centers were built, and who can tell me what are these puericultures now?
Birthing facilities.
Yes. So actually, right now, these periculture, they were called periculture centers during that time, but these are what we see right now as the rural health units. Okay, so these periculture centers during 1924, I was able to see a picture of my grandmother, of our grandmother, uh, in the periculture of Dulag. No? So may da talaga hadto nga mga panahon no periculture centers, no? And they were under one head, no? And then under this head may mga doctors nga gin a-assign hini nga mga periculture centers. And up to today, no, these periculture centers are what we see as the rural health units of each municipality. Authority was given to the government to take over management of those centers which had ceased operations for 5 consecutive years, while exemption from certain fees encouraged organization in the creation of new ones. Okay, so this was one of their um, uh, posters, no, to encourage people or the community people that they make use of the pericultures in their municipality or in their locality. So on March 8, 1922, the Philippine legislature mandated the health examination of all school children at least once a year through Act number 3029. Yeah. Prevention became a key strategy, and so vaccinations against smallpox, cholera, and typhoid were mandated. Sadly, the program was burdened by the lack of trained personnel. With the aid of the Rockefeller Foundation, additional training was provided, no, because of this lack of trained personnel, uh, to address the long-standing need of the Filipino health workers to acquire knowledge on combating diseases and illnesses. So among the projects undertaken by the foundation was the establishment of the School of Public Health and Hygiene at the University of the Philippines. So the right now, the School of Public Health and Hygiene is what we call the College of Public Health at the University of the Philippines. The health of school-aged children was likewise not neglected during the Woods term. No? So amo to nga ira talaga gin push ini nga mandatory examination of school children at least once a year. So I think naman every one of us were able to, when we were in elementary also, we were able to have this check up. Diba? May dahad to, no? When we were in the elementary and vaccination, the school nurse and the rural health nurse would go around the schools and vaccinate us. So this was the College of Public Health in the University of the Philippines. So in 1932, Theodore Roosevelt Jr. became Governor General of the Philippines. No? So Roosevelt's aggressive stance on public health served as one of the hallmarks of his administration. So kung makikita niyo, no, during that time, even from the Spaniard time until the American time, though, they really put emphasis on public health. I don't know why right now, no, with the Philippine government, no, medyo the health is not the priority. The Department of Health is not given the most of the budget, no. Wherein para ako, no, we really need to focus on the health, on the Department of Health, and then the other departments magsusunod-sunod naman la ito here. But anyway, so Roosevelt's aggressive stance on public health served as one of the hallmarks of his administration. Within his first year in office, Roosevelt abolished the Philippine Health Service, the Office of the Public Welfare Commissioner, and the Tuberculosis Commission, and combined these agencies under the Bureau of Health and Public Welfare. So, di rin na iba-iba, ira na naging usa, no? Bureau of Health ang tawag and Public Welfare through Act number 4007. All these services were placed under the newly created position of the Commissioner of Health and Welfare. So, Commissioner of Health and Welfare pantawag hato because Bureau pa man lahiya. Okay. So within his first year in office, Roosevelt abolished this Philippine Health Service and the Office of the Public Welfare Commissioner and the Tuberculosis Commission and combined these agencies. So amo nito Bureau of Health and Public Welfare. Okay. With this act, Roosevelt united all the agencies of the government relating to public health in one department. So this is Dr. Basilio Valdez, a medical examiner for the Philippine Constabulary and the chairman of the Board of Medical Examiners, and he was named the acting commissioner of health and public welfare. So Roosevelt's administration saw efforts to involve the private sector in matters of public health and initiatives to inform the greater public about healthcare. He solicited the participation of private practitioners as represented by medical groups like the PMA, the Philippine Medical Association, and the Colegio Médico Farmacéutico de Filipinas. To increase awareness among people in matters relating to health, the Bureau of Health publication has this that called the health messenger was converted into an organ for the dissemination of health related information. No? So educational posters were disseminated and community assemblies were convened, usually during fiestas and festivals for public lectures on health. And this was in addition to the use of public radio in the dissemination of health information. So we could already see the importance of media during that time, importance of information campaign and health education. So about 30,000 copies of each monthly issue was translated into the popular dialects of the archipelago, besides English and distributed in pamphlet form. In 1934, Dr. Jose Fabella, the person in the picture, was appointed Commissioner of Public Health and Welfare. Disaster and emergency management became a mandate of the Commission on Public Health and Welfare during this era. As head of the newly renamed and reorganized Department of Health and Welfare, Dr. Jose Fabella prioritized programs against tuberculosis, malnutrition, malaria, leprosy, gastrointestinal diseases, and high infant mortality. With the ratification of the Tidings-McDuffie Act by the Philippine Senate in 1935, the country was well on its way towards total independence. So the act provided for a 10-year transition period, a time for preparation during the Philippines strengthened, during which the Philippines strengthened its capacity for self-governance. So this is the Philippine Commonwealth. Under the Commonwealth government, Manuel Quezon became the first president. So under the Philippine Commonwealth, on May 31, 1939, the Department of Health and Public Welfare was born. Dr. Jose Fabella became the first Secretary of Health and Public Welfare, which was tasked with the protection of the health of the people, the maintenance of sanitary conditions, and the proper enforcement of health laws, sanitation, and social services. Health and social welfare were important cornerstones of the social justice program under this Commonwealth of the Philippines. Despite limited funds, the government was determined not only to continue but to build on the achievements made under the American rule. So under President Quezon's leadership, the government built and improved hospitals, health facilities, and puericulture centers in the country. Training on maternal and child health services, the mentioned, were made more comprehensive and nurse supervisors were made to take public health nursing courses. Sanitary divisions were expanded. So right now, that's why we have our rural sanitary inspectors in our rural health units. No? Ironic to tell or to inform everyone that even President Quezon succumbed to tuberculosis. Yun. President Quezon, who himself suffered from tuberculosis, swears in Dr. Fabella, who was retained as head of the Bureau of Health. The president increased the Bureau's budget by more than 1 million pesos in 1938. So, ang pag-swear in ni Dr. Fabella maging Secretary of Health was already President Quezon was already in the hospital. But poorly, no, if you would see the picture, the President Quezon had tuberculosis during that time, pero makikita niyo waray mask sa mga tao. So, medyo still on the progress and education and about tuberculosis in the country. So these efforts were supported by the private volunteer organizations and religious groups who became the government's partners in providing health services for free or at a nominal cost. So with the financial assistance from the PCSO, for example, national charity clinics were established in 1939 to address the inequities of health resources. New doctors were encouraged to start practicing outside of city centers, and to render free consultation services to indigents for at least 2 hours every day. These charity clinics included ambulatory dental clinics as well. So it was also during the Commonwealth era that a public health laboratory with modern facilities was created. This is the Institute of Hygiene, and the Philippine General Hospitals were reorganized. Several wards, including a unit for the treatment and study of cancer, for which an entire building was constructed, was added to the Philippine General Hospital. On February 14, 1945, an emergency hospital with a 100-bed capacity was established by the Philippine Civilian Affairs Unit to cater to civilian war casualties. It grew up to a training hospital in 1947 and was named North General Hospital, or the NGH, and at present it is known as the Jose Reyes Memorial Medical Center, a tertiary level teaching training general hospital located at Santa Cruz, Manila. So from a 100-bed capacity, which caters only to civilian war casualties, it now grew to a tertiary level hospital, the Jose Reyes Memorial Medical Center, the JRRMMC. Okay. So the gains of the Commonwealth, however, were soon crushed by the onslaught of the conquering Japanese imperial forces. Now, on December 6, 1941, the Japanese bombed Pearl Harbor in Hawaii, and the Philippines, as an American ally, found itself at war. Over the next few weeks, the carefully orchestrated assault of the Japanese culminated in the occupation of Manila, while the American and Filipino forces made a last stand on the island fortress of Corregidor. So this one is a picture of the legislative building of the Commonwealth of the Philippines and one of the casualties of the war of the Japanese bombing. The Japanese occupation was relatively brief, but the Japanese-sponsored Philippine Republic, and they inaugurated Jose P. Laurel as the president. But as we all know in our history, Jose P. Laurel was the puppet president, right? So from 1942 to 1943, during this Philippine Republic, Claro M. Recto served as Commissioner of Education, Health, and Public Welfare, with Dr. Eusebio Aguilar as the Director of Health. So the Japanese occupation was relatively brief, lasting only from 1942 to 1945. But for the Filipinos who lived in fear and deprivation, those years were a long, horrible nightmare. Food and medicine were scarce. Diseases like malaria and tuberculosis ravaged over the country. So as mattering of health directives, regarding the operation of sanitary markets, the distribution of milk and submission of reports concerning outbreaks of diseases were issued between these years. So in the following years, 3 health institutions were created. So even though there was the Japanese were here and people were suffering, may dalagi hapon na nahimo ng mga institutions. So these were the Philippine Malaria Relief Association, the Board of Nutritional Research, and the Medical Plan Committee. Finally, towards the end of Japanese occupation, President Laurel issued Act Number 37, which reopened puericulture centers in the rural health units or in the local government units and established new ones in the municipalities and chartered cities in the Philippines. On February 27, 1945, before that, no, General Douglas MacArthur left Corregidor with a promise to return. And on February 3, 1945, after a series of battles fought over land and sea, the general made good on his vow and liberated Manila. And on February 27, 1945, under the leadership of President Sergio Osmeña, the Commonwealth Government of the Philippines was reconstituted. General Basilio J. Valdez was appointed as Secretary of Health and Public Welfare, Secretary of National Defense, and Chief of Staff of the Philippine Army as well. He was soon replaced, syempre, because he was an army, no? He was soon replaced by Dr. Jose C. Locsin as Acting Secretary of Health and Public Welfare. War had indeed left the nation in a weakened state. But with the end of the Commonwealth period in sight, nothing deterred the nation further from achieving the dream of independence. No? So a survey of the health and sanitary conditions in post-war Philippines conducted by the United States Public Health Service reported grim findings. The cases of infectious diseases were high, malnutrition and beriberi were widespread, public sanitation was in deplorable state, and destruction of health infrastructure posed new threats of cholera, plague, smallpox, and other epidemics. But no, even though the war has really decapacitated our public health in the Philippines, the Filipino people really was not deterred with achieving their dreams of independence and achieving the dreams of a good public health. So I will leave you with this from Governor General Leonard Wood. Public health and sanitation must be given more attention and support, because it is in the care of the sick, the insane, and the helpless that the civilization and development of a people is in large measures indicated. So I hope this will inspire you to continue on pursuing your dreams to becoming doctors. And some of you may choose public health. So yun. Budget in public health is being lobbied also to be increased, because as what this Governor General Leonard Wood said, it is in the care of the sick and the insane and the helpless that the civilization and development of the Filipino people will be measured largely. Okay. So I think that would be all for our topic for today. Do you have any questions?
Doc,
Yes.
and periculture centers po, naabot po ba doon mga far-flung areas, pati po mga indigenous people?
No. During that time, the periculture centers were centered in the city, in the mga capital, and mga provinces and mga regions at first, And then after, dito na nira nakita nga kailangan during the Japanese period, dito nira nakita nga kailangan ang mga munisipyo. But still, the indigenous people and the far-flung areas were not catered or was not able to be reached, until now ngani, with our rural health units. Bisan tag-usa-usa nga munisipyo may ada, still may dalagi hapon mga population nga di rin natin nare-reach. And it's a challenge to the public health system. One good program of the Department of Health was the Doctor to the Barrios, or the DTTBs. This is a program of the Department of Health to deploy doctors who are willing to be deployed to the doctorless communities in the country. So if you could remember, if you could see, we have our DTTBs at the Department of Health, and we really deploy them to municipalities or to localities na waray doctors. Damo pa waray doctors din sa Philippines sa mga rural health units. And it's still a challenge. So amo to, one of the programs of the Department of Health, the DTTB, will bridge that gap. Okay? Some more questions?
Doc, curious lang sa doctors to the barrio. What are they, Doc, and are they the same doctors that we are seeing in the hospital during rounds and consultation, and how do they earn po?
Okay. The Doctor to the Barrio program is a program of the Department of Health wherein amo to na sinisiring no, yung deploy hira. No, yung deploy naton in hira. And these are through application sa Department of Health, because this is like a trabaho, no? Nagtatrabaho hira under the Department of Health, no? So they are being paid or ginsisweldohan hira, no? Just like a normal government person. So this is a bagay nag-apply kang trabaho as a doctor to the barrio or the DTTB, but plantilla position ha government. So we don't have a plantilla or a regular position nga nakabutang doctor to the barrio. Okay? Pareho tayo nakikita sa hospitals, mga medical officer 3, medical officer 4, no? They are not these doctor to the barrios are what we call rural health physicians. So under the plantilla government, its position is rural health physician, and then they are being deployed as doctors to the barrio. Now, how do they earn? They are being paid by the government. The DTTBs are being paid by the government also, just like any other residents nga adto hospitals nga yun nakikita. Now, the only difference is the Doctor to the Barrio program at the Department of Health, diri ka ng residency program. You are at the same time as a doctor to the barrio or as a rural health physician, you are deployed to the doctorless community, and at the same time you are studying your master's in public health at the University of the Philippines College of Public Health. Okay, but last year there was also a referendum na ang mga doctor to the barrios at the same time nga nagma-masters of public health hira, they can do the residency training for family medicine, the practice-based residency training. Ito nga bisan ato ka ha imong community nag-undergo kahin residency training nga family medicine. Diri ka ato hospital. Pero there are still modular type nga by the time nga makadto ka hospital for that training. So yun. And it's a good pay actually. It's not diri guti ay it's sweldo hit rural health physicians. No? It is salary grade 24. Okay? Salary grade 24 is 83,000 I think. Wait lang. Salary grade 24 is 86,742 right now. Okay? So when I was a municipal health officer, I was like a rural health physician. So that was also salary grade 24. Yun. So amo to kuan nga nababaydan hera. Sweldo through salaries also. And then they have other benefits pa. So yun. You are able to serve the doctorless community public health wise, no? Then you have your masters in public health, and then you get to have the opportunity also if gusto mo mag family medicine training, no? And it's a contract for 3 years. During our time it was a contract for only 2 years, pero last year tag 3 years na nila contract because also of the family medicine training. Kaya at least pag matapos mo an imo contract as DTTB, eventually matatapos mo gihapon ang imo family medicine training and your master's in public health, which is 2 years. May mga anakon mga kabatch han masters awhan when I was a municipal health officer. I have friends who were DTTBs. I was not a DTTB, so I was really a municipal health officer and LGU hired. But may mga kabatch ako, mga kaedad ko, mga DTTBs, and their masters was master in public management, major in public health systems policy, so MPM, and they study at the Development Academy of the Philippines, Tagaytay. Pero ang mga yan ang mga succeeding ang mga DTTBs, their program is for the Masters in Public Health. So, yun. So, during that time liwat nga nag-MPM na ako mga kabatch, I was doing my MPH, my Masters in Public Health. So, they earn pa din, no? Ang iyo lang kasi, diri sugad ka lucrative. Dako at sweldo, no? Dako at sweldo, pero diri pareho yung makikita nga mga social nga doctors nga adto mga hospitals and mga residents, no? Because ato ka mo assign na community, no? One good thing, I have friends, no, who were really assigned in far-flung areas nga waray ATM, no? Waray nira ATM dito, ATM machine I mean. So, an ira sweldo dira nira nalalabtan, no? So, pagluwas nira from their community, damo tira kwarta. But this is not only for money, no? It is for the service of the Filipino and the doctorless nga mga municipalities. Another thing how they earn is DTTBs, or the doctor to the barrios, when they are assigned to their municipality, aside from the sweldo that they receive, no, from the Department of Health, the local government unit or the municipality they are being assigned to has the prerogative to give allowance to these doctors assigned to them. No? During also our time, we have a friend who was assigned in Cebu City. He was assigned in a municipality in Cebu nga medyo harayo. So, ang iya sweldo DOH amo to salary grade 24, 80 something, no, by the hazard pay and all. Pero di rin niya nalalabtan. Why? The municipality gives him 40,000 a month na sweldo, na allowance. So, pwede na di rin niya labtan na niya sweldo nga nare-receive from the Department of Health because he could live with the sweldo or the allowance that the LGU is giving him. So, swerte lagi hapito because not all municipalities will give you, or not all municipalities liwat will give you that same amount of allowance. There were allowances, there are LGUs nga nahatag 15,000 a month, 20,000 a month, or itiba, free board and lodging para imo kay doctor to the barrio kagod, you are not from their municipality, so they will be providing you board and lodging, and then yun, may sweldo ka from the Department of Health. Yun. And you are able to serve, you get to see the community as a whole. You get to experience the grassroots level. No? If you are thinking of going into public health, no, better start from the grassroots level para pag abot nimo, like ako at this is my opinion. When I was an MHO, I was really there. Nakikita ko kung ano ang kabutang ang munisipyo, anong kabutang ang grassroots level. And pag abot ko nga di Department of Health, I am able to impart what the experiences I had. Because para nakikita ba, because di man good regional level it mga tao didi, they don't know what's happening at the grassroots. So if you are from the grassroots and you come to the regional level, you will understand kung kay ano daw na reason, kaya ano ini nga mga programs si Department of Health diri na accomplish dito ubos. Ano reason, ano't mga hindrances. So para akon, because I was able to be there, maaram ako kung ano ang mga hindrances, amot ako nagagamit na apply ko di regional level yan na di akon work na address kay kailangan nirahin technical assistance, kailangan nirahin mas damo pa nga tao, so kailangan na tagan hirang atong tao, kailangan tatagan hirang trainings and all ang ganyan. So you get to understand the reason why your public health in your municipality is not that well, because there are reasons behind that. And then you have to help the municipality. So if you are going to proceed to public health, I suggest you apply for the Doctor to the Barrio program. No? Because aside from helping your Filipino people, you have your masters, you have your training, and then you get so many insights. Bonus na lang ito, it's sweldo nga dako. Okay? But anotherly, what it how it is different, no? How it is different from the doctors we see at the hospitals. The doctors that we see at the hospitals are residents in training. So after their training, they will take their diplomate examinations. So they will become consultants, no? So hiralo ito mga specialista nga nakikita naton nga nagra-rounds at mga consultants na mga nagra-rounds, no? So if you want to become specialists, no, you go to residency training, no? Anesthesiology, derma, and IM and all ang ganyan. And yun lang. The salary for the medical those on training also is not that high. It's just like if you are a rural health physician, it's salary grade 21. But after naman your training, then you become specialists, then you do your private practice, you get to earn man gihapon. So in any case, no, you get to earn. Not all doctors would become rich. If you took medicine to become rich, then this is not your course, supposedly. Pagnegosyo na lang. Kaya it kapoy hit medicine is not in comparison hit imo nga magreriko ka, no? But doctors, there is no doctor nga nakikita ko nga diri comfortable. Okay? Again, not all doctors will become rich, but all doctors are comfortable. So kung gusto mo magriko, pagnegosyo. Pero kung gusto mo lang mabuhi and you pursue your dream as the doctors, then yun. Pursue becoming a doctor. Kahit kapoy, diri siya sadang. Iti mo ambisyon na magriko. Good pay, pero yun. You will live your day-to-day. Yan. Other concerns? Other questions?
Hello po, Doc.
Yes,
Doc, di ba yung the doctors to the barrio, is it the same with the physician deployed personnel under the HRH ng DOH?
Yes, but we have Doctor to the Barrio program. We have the Rural Health Physician Deployment Program. So iba-iba po. Yeah. May na kasi mga slots lang for the Doctor to the Barrio. So kung Doctor to the Barrio napuno na slots, then kasi you still wanted to apply, then bagong kikitaon nito didi kung may dapan Rural Health Physician Deployment Program. But the same lang an era salary grade, the same lagi hapon. Actually, Doctor to the Barrio is a Rural Health Physician. So, diliwat, Rural Health Physician Deployment Program. So, bagalahiyan, diri Doctor to the Barrio nga program. So, waray hiya and Masters in Public Health, waray hiya, diba? Yeah, benefits. Yun. Damo nagihapon mga taga-RTR nga graduates, no? Nga nakita ko nga ng community medicine, public health. Ako, for myself, I wanted to become a dermatologist when I was still in the nursing and medicine. Dermatologist ko na nakaroon. Dermatology, I mean. But there were other plans. May day mga plano ang Ginoo. Yun. Other questions? I see you are interested with Dr. Todo Barrios and public health, so I hope to see you after your medicine, after 5 to 6 years. Or 4 years na lang. 4 years. 4 to 5 years. Okay, so if there are no other questions, I think this would end our lecture for today, and see you next week. We will be discussing about the Department of Health and the Department Secretaries, no, and mga tikang hanggat tikang and era mga programs. Thank you so much.
Thank you, Doc.
Thank you po,
Thank you po,
Doc.
Doc.
Thank you, Doc.
Doc.
Thank you, Doc.
Doc.